Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the drugs which are associated in SLE? In the SLE, there are some drugs which are associated in the SLE. Like, what are the drugs associated with lupus, systemic lupus erythematosus? Right. In the drugs associated, we have antiarrhythmic drugs like procainamide, disopyramide, propafenone are associated with SLE. Similarly, antihypertensive drugs like hydralazine, ACE inhibitors, we have beta blockers, all these are associated with SLE. Similarly, we have anti-thyroid drugs like propylthiouracil. Okay, anti-thyroid drugs like propylthiouracil is associated with SLE. Then we have antipsychotics. In the antipsychotics, we have chlorpromazine and lithium may be associated with SLE. Then we have anticonvulsants. In the anticonvulsants, we have carbamazine, and also phenytoin is also associated with SLE. Then we have antibiotics like minocycline, macrolides or isoniazid are associated with SLE. Then we have antihyperlipidemics like lovastatin and simvastatin. Lovastatin and simvastatin are also associated with SLE. So, among all these drugs, if you were asked what are the most important drugs which can cause SLE, are most important drugs which can cause SLE are then there are few drugs like SHIP, that is sulfonamides, H for hydralazine, I for isoniazid, and P for procainamide. So all these will result in SLE.
thank you and thank you for watching.